Thank you for the introduction. We appreciate the opportunity to present our experience in enrolling cisgender adolescent females in an injectable PrEP trial in Sub-Saharan Africa while facing a global pandemic and social barriers. HPTN 084-1 is a single-arm, open-label clinical trial examining whether injectable cabotegravir for PrEP is safe, tolerable, and acceptable for cisgender adolescent females. Long-acting injectable PrEP has the potential to protect people from HIV without having to take a daily pill. 55 cisgender adolescent females under the ages of 18 were enrolled in South Africa, Uganda, and Zimbabwe. So in step 1 of the trial, participants take 1 pill every day for 5 weeks. In step 2, they receive 5 cap injections over 6 months. Step 3 is 1 year of follow-up with the option to receive daily oral PrEP or continue cap injection in an open-label extension study. We encountered 2 recruitment hurdles, an unprecedented global pandemic, and social barriers. COVID-19 restrictions resulted in travel curfews. Passenger limitations on public transportation made it difficult for participants to get to the clinic, and study drivers had to screen passengers for symptoms and sanitize vehicles between trips when transporting them. Virtual contact was not an option for prospective participants who lacked access to devices and could not afford data. Deeply rooted, long-standing social barriers included low risk perception and low awareness of PrEP. So the relevance of using an HIV prevention intervention, much less the relevance of participating in an HIV prevention clinical trial, was a challenge. To recruit this complex population, community engagement staff were tasked with addressing adolescent awareness of research and parents' lack of familiarity with clinical trials. So in our community, sex before marriage was recognized as taboo, and non-disclosure of sexual activity to parents was common practice. Contraceptive use is a requirement in the study, but prospective participants were disinclined to use them due to myths about them causing ongoing fertility. Parental guidance consent was necessary for such study participation, but parents were often inaccessible to provide consent due to employment. Traditional in-person community mobilization group events were modified to targeted individual in-person interactions, namely snowballing, community outreach, and adolescent health referrals. So community engagement staff encourage HPTN 0841 participants to refer close friends, family, and others to the study. Research literate adult cisgender females and former and current participants in long-acting PrEP studies were recognized as PrEP ambassadors. They understood the purpose and objectives of HPTN 084-1, its benefits for cisgender adolescent females. Some of them used text messages and individuals' interactions to make referrals to the study from their communities and even referred their daughters. Incentives were provided to encourage participants' referral. And for every 5 referrals, incentives were offered in the form of coupons and PrEP gifts. So community outreach. With this recruitment strategy, community health workers and community outreach staff engaged cisgender adolescent girls in the community while using appropriate COVID-19 prevention strategies. Adult and youth CAP members supported community outreach staff in identifying places where potential participants were likely to be accessible, such as parks, malls, and hair salons. So with the permission of the clinic manager, community health workers and community outreach staff provided an overview of the study to adolescent health clinic staff. Once a relationship was established with the clinic staff, study staff were permitted to explain the study to prospective participants attending the adolescent health clinic. Prospective participants expressed interest in the study and clinic staff made referrals accordingly. Despite the COVID-19 related restrictions, more than 300 prospective participants were contacted and 73 screened between November 2020 and July 2021 to enroll 55 cisgender female adolescents. 36% came from outreach in the community and 7% from adolescent health clinics, referrals. More than 60,000 contacts were made through social media, which raised awareness about PrEP and HPTN 084-1, but did not produce enrollments. So in conclusion, we urge that researchers in Sub-Saharan Africa should consider PrEP use ambassadors, community health workers, and community outreach staff to reach PrEP-eligible cisgender adults and females. These strategies could also be employed by PrEP program implementers to reach adolescents in need of HIV prevention services in the COVID-19 era. The HPTN 084-1 protocol team recognizes the courage and commitment of the study participants and their families, the site staff, and the communities, and support them. And lastly, we acknowledge all our sponsors and funders. Thank you.